because individuals can actually be helped to become their own civil society, community accountability.
We've been talking, Toyin, about the interplay between government and the charitable and private sectors. You aligned much of your work at the very beginning with the Millennium Development Goals, broadly, and now with the Sustainable Development Goals. Tell me about that decision and what that translates into for you.
You know, the reason why I actually aligned with the MDGs was because when I wanted to help, it wasn't a case of woman or first lady just, wanting to be obvious. I had very, very high expectations for my citizenry, and I didn't really feel that going for low-hanging fruit was going to be the way to solve our nation's problems. So I actually searched far and wide to find what are the global goals, and then what are our problems on the ground, and what are the good things about the way we live and the way we operate, and then how can I translate those global goals with an easy platform that people can either partner with me or people can replicate. And when I met the United Nations Secretary General at that time, Ban Ki-moon, it was like a meeting of souls. And he had what I would just call a simple to follow agenda, which allowed me to be able to pick partners, actually, from all over the world, and not just as a platform for the Wellbeing Foundation, but for the movements that I was trying to create in country, because one person, can't save every woman alone. And that led. So looking at the global goals, I then approached the Federal Ministry of Health and the National Primary Healthcare Development. Bring them back into service and get them there. The cost of the salary of a midwife is less than half of the cost of the salary of a doctor. But a qualified, trained, educated midwife is a really safe pair of hands. To guide a new life and to educate the mother. And this actually led to the midwife service scheme of the National Primary Healthcare Development Agency, where 4,400 midwives were brought back into service in 2010 and redeployed throughout the country through local governments level to the primary healthcare centers to deliver babies. Now, between 2010 and 2015, the impact of this program was so high that our survival rates went from 1 in 12 women surviving childbirth in Nigeria to 1 in 6 women surviving childbirth in Nigeria. So from the Wellbeing Foundation's perspective, we're quite small, but we have quite a big reach. And what we try to do is to find homegrown best practice models. We actually try them out. That's where my investment lies. I will take the risk, and if it works, which it usually does, I then present my findings to government and I say, okay, how can you incorporate this into your practice? Today, what used to be the midwife service scheme is now the Empower, the medical students part of the Empower, where young midwives and nurses, they're being armed with these tablet things that help them to connect to each other so that we can get more health workers out to where they're needed. It's part of the 1 million. movement. So it can be quite funny to see where the global goals actually connect on a local level. And I'll give you another example. I actually felt that midwives can do a lot more than just delivering babies. So 22 months ago, I started a program called Mama Care. And medical facilities. I think we have 31 locations now. We have reached 220,000 women in 22 months. And what we're finding is instead of the women just coming to the hospital, the target used to be 4 antenatal visits. Our mothers, our Mama Care mums, are actually coming every month. And the proof is in the pudding. Out of the 220,000 women in 31 medical facilities, we have not lost a single mother to death in childbirth.
You used an important word, and that's learning. And I think that the key, what makes philanthropy work, and what makes networks like the African Philanthropy Forum work, is that it's not just about giving, it's not just about collaborating, it's about sharing your learning so that each one is more impactful than the other. So if there's any other ethos that comes from APF, I know Mohsen joins me in hoping that is one. Minister Weiner, I do want to turn back to Liberia for a moment. And I want to do so because it's hard to work with philanthropists, collaborate effectively. It's like herding cats, right? And there's a very interesting model in Liberia in which President Sirleaf established a philanthropy secretariat And I remember there were philanthropists like George Soros and Pema Midyar who said to Madam Sirleaf, you know, you shouldn't be spending your time with us, although we keep showing up and acting like you should. Instead, have a mechanism for that and spend your time with the people you want to spend your time with, and that's your citizens. Say something about the Secretariat.
So, recently I was in Silicon Valley, and I had gone to meet with philanthropists and to essentially explain what we're doing in Liberia. And they were surprised that a minister came to talk to them, and they were also thankful. I said that in the context of what was just said. I think establishing the Philanthropy Secretariat frees the president and it frees the minister to be able to look at the transformational agenda of the country and allow a trusted young person to manage the day-to-day contact and coordinate that contact. And I say trusted because I have found that philanthropists have a challenge with trusting government, right? And sometimes they follow individuals in government, not the whole government. So there has to be, we are lucky in Liberia to have a president that's had, so to speak, a foot in that world. She came through the UNDP and all of this and knows how these individuals behave. We're lucky because she has transferred that trust and credibility to some of us. And in turn, people she knows know us, and they trust us. They do their own, manages all of this network of individuals with diverse needs on behalf of the presidency.
So one of the other themes that have come up, particularly from Toyin Saraki, is the building the capacity of government in the process by sharing data. And here's an opportunity to collaborate with government so that you're not coming in with a program that is not aligned with the goals of the government. And that's why this example has been so powerful. Let me just turn to one other very dramatic example of where philanthropy could play a very powerful role on the continent. And I'm thinking of this just because the minister from Liberia is here and Nigerians are here. If you look back when the Ebola crisis happened, there wasn't the strong health ministry, health infrastructure that was needed to cope. And so something went from an outbreak to being a pandemic. What kept it from becoming a pandemic in Nigeria was that the combination of Aliko Dangote and Bill Gates and others that had built an effort here for the eradication, I don't think we needed all those extra syllables, eradication of polio, that Nigeria was able to repurpose those clinics, repurpose those health workers to deal with a different problem, and that was the problem of Ebola. So every investment you make has the potential of having far greater impact than even you imagine. And so I wanted to make that point because it's so powerful. I want to close with a final point. I advise a philanthropist in Silicon Valley who turned to me and said, you know, I don't have the time, I'm still running my company, I don't have the time to do what Bill Gates has done, so I'm going to have to take a pause in my philanthropy. I can't stop running my company, I can't do the day-to-day. And I remember turning to him to say, we don't all need to be Bill Gates. We can't all be Bill Gates. Well, we don't all need to be Aliko Dangote, although we can learn from both of those men. So I want to thank you so much for your forbearance with this panel. I want to welcome Ambassador Symington, who has joined us. And thank you for all that you do. And please thank our panelists.